According to World Health Organization, every year more than 4 lakh children are diagnosed with cancer. Every year on 15 February, International Childhood Cancer Day is marked. This day was established in order to increase treatment rates and alleviate the distress and suffering caused by cancer in children all over the world. The day emphasizes the significance of fair access to cancer care for children who are patients or survivor of the illness. Let's know it from an expert how the diagnosis of cancer is made in children and how possible is the reversal of this disease.
Okay, so basically, what we see whenever we have a child who presents with any sort of symptoms that make us suspect the child to be having anything wrong, including cancer, would be to basically do an imaging investigation. So we usually do an ultrasound if you are suspecting kidney tumors or liver tumors, or even for that matter, neuroblastoma. And if we do find some indication towards that, then we usually proceed towards doing either a whole body CT scan or even a PET CT scan. So definitely we have to rely on an investigation such as a CT scan or a PET CT scan, and sometimes even MRI scan, to see if actually there is a visible tumor through the radiological investigations. After we find this, the next most critical step is going to be to do diagnose it through a biopsy. So if I see a tumor in the kidney, I would want to make sure that I know what kind of tumor of the kidney it is. So a biopsy, that is a needle procedure, is required, which is again done radiologically guided, and we then see this tumor piece under the microscope and try and see what kind of tumor that is. Are we looking at an aggressive tumor, or are we looking at a very very mild tumor? So based on this, we can diagnose it. There are usually other investigations such as blood tests and the liver tests and the kidney tests that not only help us to help diagnose, but also help us to understand what would be the right treatment that should be given to the child. Leukemia, that is basically blood cancer, is usually diagnosed by blood investigations. We first do a blood, the regular hemogram that we call, and the hemogram will then let us know if there are some abnormal cells or the leukemic cells that are seen in the blood. After that, we usually do a bone marrow investigation. We do a bone marrow biopsy. We send the bone marrow for histopathological examination, and through that, we will be able to understand which subtype of the leukemia that we are seeing. So, one, radiology; two, blood investigations; and three, if it's a leukemia, we do bone marrow aspiration biopsy. Okay, so by this question, I would assume that you're asking whether we are able to cure or make sure that the childhood cancer can be completely made to not come back again. So usually the rate of cure and the rate of cancer coming back are indirectly proportional to each other. For example, if I am able to achieve 30% cure of any cancer, that means there is 70% chance of the cancer coming back. So every cancer that we know of, we usually call one as a cure rate and one we call as a recurrence rate. So the cure rate means the cancer is cured, and recurrence rate means how many cancers are not cured and due to which they recur. So let me give you a simple example. If you see a childhood leukemia, a child with blood cancer, the cure rates can extend upwards of 80% to 90%, with recurrence rates of 10 to 20%. As you see, it's directly indirectly proportional. So if you are treating a very young child, a child who is maybe 2 years old or 3 years old with say lymphoblastic leukemia, in that case there is data and there is literature proof available that you can provide cures of upwards of 80% and sometimes even 90 to 95%. Now, in this, the recurrence rate would be 5 to 10%. And to make sure that we detect the recurrences early, we have to do what is called as active surveillance. That means call the child maybe once every 2 or 3 months to our clinic and do the blood investigations, and we find out. Now, when it comes to something like Wilms tumor or the tumor of the kidney, the cure rates, if they are treated in stage 1 or stage 2, would be upwards of 90% again. So, if you're able to give the standard treatment protocols, you can see upwards of that. Bone tumors, if they're diagnosed at the earlier stage, again, cure rates are as good as 90 to 95% again. So, as I would like to summarize to you, the cure rates are dependent on the type of cancer. For example, the blood cancer of a child of a boy who's 14 or 15 years old will not have the cure rates same as that of a child who is 5 years old. So you can see the difference here, because usually as the age increases in children, the cancer is considered to be a lot more resistant to the current treatment strategies. If you have any other cancer of the solid organ, it could be of the kidney, of the liver, of the bone. The earlier the stage, the better is the cure rate, and the lower is the recurrence rate. In brain tumor, this is a very important part because brain tumors are very common in children. In brain tumor, the location of the tumor is very important in determining the cure rates. For example, if the tumor is here somewhere up at outside of the brain, the cure rates are much higher if surgery is possible, followed by radiation and chemotherapy. But if the tumor is in the brainstem, that is near the neck, then the cure rates come down much more. Even in that, there are sub classifications. So there are certain aggressive varieties of brain tumor, and there are not so aggressive varieties of brain tumor, due to which it may be a different outcome when you give them the standard treatment approaches.